Hi, Katie.
Hi,
How are you?
doing well.
Well, thanks for coming in. My name is Salimata, one of the OTR.
And I'm Emily. I'm also an OT.
So today we just wanted to go over the home form. I know we gave you the school form that you gave to your daughters. Is that your daughter, right?
My
Your
son.
your son's teacher.
Mhm.
So I'm just gonna have you confirm his name and his
Rudy.
date of birth. So and then we can just go from there.
Everything looks good.
Okay. So this is called the sensory processing measure. It's a SPM. It's a behavioral sensory behavioral assessment that we use to just assess your child behavior during the past month. So the questions gonna be on social participation, vision, hearing, and then I will go halfway through the questions, and then Emily will take over and just ask you for the rest of it because we're doing this together. So the question will I will ask you, you will have to answer never, occasionally, frequently, or always. So it's gonna be on a scale of 1 to 4. So we will just rate it by from there, and then after that we'll just gather all the data, and then we'll go from there and just give you the result. Okay. So if you don't understand any question, you can still ask me. How you can ask me, I can repeat them to you. So for the first one, it's on social participation. So I'm going to ask you, does your child play with friends cooperatively without lots of arguments?
Frequently.
And does your child interact appropriately with parents and other significant adults? For example, communicates well, follow directions, shows respect, etc.
Frequently.
Does he share things when asked?
Occasionally.
Does he carry on a conversation without standing or sitting too close to others?
Occasionally.
Does he maintain appropriate eye contact during conversation?
Frequently.
Does he join a play with others without disrupting the ongoing activity?
Occasionally. His presence is no.
Okay. Does he take part in appropriate mealtime conversation or an interaction?
Occasionally.
Does he participate appropriately in family outings, such as dining out or going to a park, museum, or movie?
Frequently.
Does he participate appropriately in family gatherings, such as holidays, wedding, or birthdays?
Always.
Does he participate appropriately in activities with friends, such as parties, going to the mall, and riding bikes, skateboards, or scooters?
Frequently.
So now that was the social participation section. We will move on to the vision part. Okay. So does your child seem bothered by light, especially bright light, like blink, squint, cries, close eyes, etc.?
Never.
Does your child have trouble finding an object when it's part of a group or other things?
Uh, Frequently. Yeah.
Does your child close one eye or tip his head back when looking at something or someone?
No. That. Never.
No. Do you want me to repeat you?
Yeah, no,
Okay.
it's never.
Okay. Does he become distressed in unusual visual environments, such as a bright, colorful room or a dimly lit room?
Occasionally.
Does he have difficulty controlling eye movement when following objects like a ball with his eyes?
No. So
Is it a never,
past
occasional?
month, never.
Does he have difficulty recognizing how objects are similar or different based on their color, shape, and size?
Never.
Does he enjoy watching objects spin or move more than most kids his age?
Frequently.
Does he walk into object or people as if they were not there?
Occasionally.
Does he like to flip light switches and on and off repeatedly?
Never.
Does he dislike certain types of lighting, such as midday sun, strobe lights, flickering lights, or fluorescent lights?
No. That's a never.
Does he enjoy looking at moving object out of the corner of his eye?
I've seen it before, but not the past month. I haven't noticed that.
Is that
Never.
okay? So we're gonna move on to the hearing part. Does he seem bothered by ordinary household sounds such as the vacuum cleaner, hair dryer, or toilet flushing?
No.
Does he respond negatively to loud noises by running away, crying, or holding hands over ears?
Occasionally.
Does he appear not to hear certain sounds?
My voice.
Okay. Wow.
No. I'd say never.
Does he seem disturbed by or intensely interested in sound not usually noticed by other people?
Never.
Does he seem frightened of sound that do not usually cause distress in other kids his age?
No. Never.
Does he seem easily distracted by background noises, such as lawnmower outside, an air conditioner, a refrigerator, or fluorescent lights?
Never.
Does he like to cause certain sound to happen over and over again, such as by repeatedly flushing the toilet?
What if it's his own voice?
Does he like to listen to his own voice?
He will repeatedly sing songs over and over and over and over again, or
Well,
make
then he likes to
sounds
sing
over
then.
and over and over again.
So that will be right. So I'm gonna repeat the question again so we know, so we can get it right, okay? I'm not saying you don't get it wrong, but that is something that not unusual. So try to
Likes to cut
go
certain-
with the sound that we have here,
Oh, okay. But then never.
like such as by repeatedly flushing the toilet.
He does not do that. He's
Okay.
never done that.
All right. I don't think singing. I think a lot of people like to sing, so I feel like so. All right. Does he show distress at shrill or brassy sounds such as whistles, party noisemakers, flutes, and trumpets?
No. I wish he did.
Does he like to listen to his own sound? Not that does. So we're gonna move on to the touch.
Okay.
Does your child pull away from being touched lightly?
No.
Is that a never?
That's a never.
Okay. Does he seem to lack normal awareness of being touched?
Frequently.
Does he become distressed by the feel of new clothes?
Occasionally.
Does he prefer to touch rather than to be touched?
Always. Oh no, sorry.
Does he? Do you,
Prefer to touch as opposed to be touched. Occasionally.
does he become distressed by having his fingernail or toenail cut?
Always.
Right there. Does he seem bothered when someone touches his face?
No, never.
Does he avoid touching or playing with finger paint, paste, sand, clay, mud, glue, or other messy things?
Always.
Does he have an unusual high tolerance for pain?
Never.
Does he dislike teeth brushing more than most kids his age?
No, never.
Does he seem to enjoy sensations that should be painful, such as crashing onto the floor or hitting his own body?
Always.
Okay, body. And does he have trouble finding things in the pocket, bag, or backpack using touch only without looking?
Frequently.
So I'm gonna let Emily just do ask you the remaining questions, so we can get through that.
Do you have any questions so far? You holding in okay?
No, I'm doing well. Thanks.
Okay. All right, so now I'm going to ask you a few questions about taste and smell. Does your child like to taste non-food items such as glue or paint? So never. Does your child gag at the thought of an unappealing food such as cooked spinach?
Frequently.
Does your child like to smell non-food objects and people?
Never.
Does your child show distress at smells that other children do not notice? Does your child seem to ignore or not notice strong odors that other children react to? Okay, so that was it for taste and smell. The next section is body awareness. Does your child grasp objects such as a pencil or spoon so tightly that it is difficult to use the object?
Never.
Does your child seem driven to seek activities such as pushing, pulling, dragging, lifting, and jumping?
Always.
Does your child seem unaware of how far to raise or lower the body during movement, such as sitting down or stepping over an object?
Never.
Does your child grasp objects, such as a pencil or spoon, so loosely that it is difficult to use the object?
Never.
Does your child seem to exert too much pressure for the task, such as walking heavily, slamming doors, or pressing too hard when using pencils or crayons?
Frequently.
Does your child jump a lot?
Always.
Does your child tend to pet animals with too much force?
Never.
Does your child bump or push other children?
Occasionally. It's not on purpose.
Does your child chew on toys, clothes, or other objects more than other children?
Frequently.
Does your child break things from pressing or pushing too hard on them?
No. Never.
Okay, so the next section is balance and motion. So does your child seem excessively fearful of movement, such as going up and down stairs or riding swings, teeter-totters, slides, or other playground equipment?
Occasionally.
Does your child have good balance?
Yes.
So would you say
It's good balance.
often, frequently, always?
Always.
Does your child avoid balance activities such as walking on curbs or uneven ground?
Oh, never.
Does your child fall out of a chair when shifting his body?
Occasionally.
Does your child fail to catch himself when falling?
Never.
Does your child seem not to get dizzy when others usually do?
Always.
Does your child spin and whirl his body more than other children?
Always.
Does your child show distress when his head is tilted away from the upright vertical position?
Never.
Does your child show poor coordination and appear to be clumsy?
Occasionally.
Does your child seem afraid of riding in an elevator or on escalators? And does your child lean on other people or furniture when sitting or when trying to stand up?
Always.
Okay, so we are on to the last section, which is planning and ideas. Does your child perform inconsistently in daily tasks?
Frequently.
Does your child have trouble figuring out how to carry multiple objects at the same time?
Always.
Does your child seem confused about how to put away materials and belongings in their correct places?
Frequently.
Does your child fail to perform tasks in proper sequence, such as getting dressed or setting the table?
No.
Okay. Does your child fail to complete tasks with multiple steps?
Frequently.
Does your child have difficulty imitating demonstrated actions, such as movement games or songs with motions?
Frequently.
Does your child have difficulty building to copy a model, such as using Legos or blocks to build something that matches a model?
Occasionally.
Does your child have trouble coming up with ideas for new games and activities?
Never.
And the last question is, does your child tend to play the same activities over and over rather than shift to new activities when given the chance?
Occasionally.
Okay, so that concludes the questions that we wanted to ask you. Do you have any questions for us?
No.
Okay. So Sally and I will take some time to go over the scoring, and the next time we meet, we can talk about the results and go from there.
Okay. Sounds good.
Awesome.
Well, thank you.
Thank you so much for filling that out and answering all those questions. Oh, come on.